Good evening. My name is Tamara Swaggart, and I'm going to discuss my proposal for a U.S. health system. Currently, the U.S. healthcare system is a public and private healthcare system, meaning that we have government-funded medical care as well as private-funded medical care that generally comes from deductions from employers for pre-tax deductions from employers. We have a mixture of the four different types of healthcare systems. The first one is a Beveridge model, which is government funded. The next one is a Bismarck model, which is privately funded. And then the national insurance model, which is a mixture between the Beveridge and the Bismarck model. So it is government funded, but it also has some private with private facilities. And the out-of-pocket model is basically if the patient can afford the healthcare, then they're able to get the treatment. If they can't afford it or they can't meet their deductible, then they're unable to get the treatment. Our healthcare system currently right now is very politically driven. It's always a major topic in all of the political discussions in regards to lowering costs and making healthcare universal in the United States. The advantages of the U.S. health care system includes we have a well-trained workforce. The U.S. spends a lot of money on making sure that providers, nurses, and support staff are all properly trained. We also have advanced research in the United States to allow us to discover and come up with preventative measures as well as vaccinations. We have patient autonomy. Which means that the patient can choose whether or not they can get a treatment or not. They're not forced to actually get the treatment that the provider is suggesting. It's totally up to the patient whether or not they want to get that treatment or not. We have improved quality of care. So a lot of our systems focused on making sure that the outcome is the best outcome for the patient. And that the research and the treatment all meets what's medically necessary for the patient. We have specialized services. So instead of having one provider complete treatment, we have specialized care here in the United States that allows for a better outcome. So for example, if you have a knee injury, you will go to an orthopedic specialist who specializes in that injury instead of staying with your primary care. It yields to better results. And then we put a focus on preventative care. So just making sure that you have preventative care appointments to help reduce the chances of being diagnosed with certain conditions, especially cancer. We have a lot of screenings that are set up in our healthcare systems to help prevent further diseases and further outbreaks of different health conditions. Some of the disadvantages of our health system is the cost of healthcare. The U.S. approximately spends $3.8 trillion a year in medical expenses. We also have a lot of healthcare disparities that are hindering our ability to have equal care and hindering our ability to have universal health care. The complexity between leadership and administration. So it makes it difficult to focus on patient care because we have a lot of entities, a lot of stakeholders involved in our system. So everyone has to kind of be on the same accord in order to pass certain things, even with legislation, as well as within the government. We have for-profit increase in cost. So we have a lot of for-profit organizations which have an increase in cost. They have to pay out a lot to a lot of the administration as well as the providers, the healthcare insurance, and they also get money back to help fund their services. So we have a lot of for-profit organizations here in the United States. My proposed healthcare model is the national insurance model. It's mostly in Canada. That was where it was first originated, and that's where the Canadian model is focused on the national insurance model. It's a private sector providers, but it's all funded through the government. So they use tax funds to help fund their medical system over in Canada. Cost is significantly lower than the U.S. And it requires a balance between both private and nonprofit organizations. So there's no over competition, or there's no healthcare system that provides better care within the system, or wages for you to be able to have spend less amount of money on certain amount of cares. Everything is all standard with a government based fee schedule. So basically, wherever the patient decides to go, the same funds will be transferred through the government to that provider, and not with a competition rate. Payroll deductions are used for tax deduction purposes. So the payrolls are already set up for pre-tax deductions. That payroll then goes to the government. The government then issues an allowance and allocate the amount of money that is needed for healthcare. And then each person is provided the ability to have healthcare in Canada. It decreases the amount of medical debt for patients. The United States has a substantial amount of medical debt. And with the national insurance model system, it decreases that debt because the money is paid up front through the government instead of the out-of-pocket price or the high deductible price or like a health savings program. The money is pre-taxed and take out at a higher rate. However, it prevents the patient from having an outstanding amount of debt and balances after receiving a medical treatment. It improves health equality. So basically, everyone should be offered the same amount of health care and have the same outcome, no matter what their race, ethnicity, disability, or anything of that matter is. So when you have health care that is equally dispersed throughout a system to the patients, then it decreases the chances of discrimination or bias, and everyone has the ability to obtain the same amount of care. To implement this, you have to establish the tax deduction needed to fund an appropriate healthcare plans. So that goes with allocating the amount of funds that are needed to properly process claims and to pay out for insurance. The structure must focus on structure design and mechanism of funding. Once the allocation of the funds is set, then the structure must go through the employers so that the government is receiving the funding at a timely manner so that it can pay out. Lowering administration costs is important. So the cost to salary employers, administration, leadership, presidents and vice presidents of hospital systems, they often get their salary, and they also get bonus for meeting certain type of in-hospital metrics. However, with this type of system, you will have to decrease that amount of metrics that is used. Sorry about that. You have to decrease the amount of metrics that is used so that we can then allocate those funds elsewhere. Single payer systems support revenue collection. So if one system is being used for payment, then it allows for reimbursement to be placed faster at a faster rate so that they collect the amount of funds available. Some obstacles consist of drawback from for-profit organizations and administration. So obviously, administration is not going to support decreasing their bonuses and their funds. However, maybe allocating those funds and knowing that they wouldn't have to pay so much in healthcare expenses can help drive and progress the healthcare system. As well as for-profit organizations, if they're less likely to get reimbursement for healthcare expenses, then they're less likely to want to be a part of this system because they're not getting any money in return. Identify goals and engage in stakeholders. So when implementing any type of process, you always have to engage your stakeholders. So dealing with government officials, the IRS, tax deductions, the employers, and everyone, all the agencies that are involved, they must be able to properly discuss how much funding needs to be allocated to be able to provide government assist medical care. In conclusion, the national insurance model offers universal health care. Canada has had universal health care for a while now. They implemented this system. There have been some obstacles in the type of care that has been received. However, in general, they have seen some improvements in universal health care. It reduces healthcare costs. Americans struggle with being able to afford healthcare and being able to afford the out-of-pocket costs and the deductibles after receiving treatment and care. So this helps reduce it. Implementing the national insurance model helps meet goals and helps actually put in forefront the things that Americans are actually complaining about when it comes to our healthcare system. It allows us to meet long-term healthcare goals and improve quality of care, and innovative ways to meet goals such as telemedicine and virtual preventative care medicine. So decreasing the cost for certain appointments will help. If the government accepts it and the government approves it, then it will help decrease the overall debt that is collected throughout the process. That was my presentation. I hope you enjoyed. Thank you.